Hey Devin, how are you today? What brings you into the office?
I really don't know what's been going on with me lately. I've had a cough for a couple of days, some sporadic headaches, and a sore throat that always goes away by the end of the day.
Hmm. Seems like it could just be a cold, but the flu is going around. I guess we'll get you tested for that too. Maybe some breathing tests. You never know these days. Better safe than sorry, right?
Okay. My close friend is just getting over a sinus infection. Should I be taking Dayquil?
Well, maybe. Let's get you tested for the flu and the lung test, and then we can also put you on Dayquil if everything comes back clear.
Okay. Thank you.
This doctor obviously cares, but he is really unsure of what is wrong with his patient. Because the patient is covered with a fairly good insurance plan, the doctor knows he can get away with ordering tests to cover himself, even if the likelihood of the patient having such severe conditions is unlikely. Demand is created because the doctor isn't sure which treatment route to go down. If he orders everything that it could potentially be, he'll eventually find what's wrong from the test results.
Hey Devin, what brings you into the office today?
Well, I haven't been feeling well in more than 3 weeks, and I have this cough that just won't go away.
Okay, did this start off as a cold, or has it just been the cough for the past few weeks?
Yeah, it started off as a cold, and the rest of the symptoms all went away a couple of weeks ago with the runny nose and the headaches.
Well, it is fairly normal for a cough to last a few weeks after you have a cold, but there are a few things we can do to make sure that it goes away faster. First, you can start by taking some cough syrup that we sell right here in our remedy room. It's an herbal medication that I developed myself that seems to do the trick. I will also prescribe some antibiotics. Additionally, I feel that you should probably have a chest x-ray and blood work just in case.
Okay, where can I have that done?
We do those at our outpatient center just across the street, and we also take care of the billing. After we get those results, we will schedule another appointment together so that we can go over everything and see how you're doing.
Okay, that will be perfect. I know that my insurance will cover it, and I'll make the appointments right away.
In this situation, the physician prescribed additional tests and recommended more appointments. Most physicians are not greedy and do have their patient's best interest in mind. However, there are times when physicians act because of their own greed, and patients need to be aware of this, and there's little data pinpointing exactly how much physician-induced demand stems from greed, but it is widely accepted as a contributing factor.
Hey Devin, what brings you into the office today?
I developed a slight cough yesterday, and I thought I'd just come in and have it checked out.
Well, around this season, it is pretty common to develop a cough. It could be the cold or your asthma acting up again.
Okay, that's good news. Is there anything I should take?
I know this isn't anything serious, but this patient is an attorney. Actually, I'm going to send you over to an imaging center for some scans. I want to rule out any serious lung conditions. I'm also going to send you to get blood work. I will also refer you to a pulmonologist that can better assess your breathing.
Okay, perfect. Thank you so much.
The patient presented with a slight cough that has only been around for about a day. Without any previous medical issues, it is extremely unlikely that there is anything serious going on. The doctor was confident in his initial diagnosis, but decided to order more tests and issued a referral to protect himself against any malpractice lawsuits. The doctor isn't profiting any more from this patient, but this is driving up costs for insurance companies, which in turn drives up the cost of insurance for consumers.
In the